This is my disease research project. I chose to research cerebral palsy, which is actually disorder that is caused by damage to developing brain or abnormal development of the brain. Cerebral palsy is not contagious or linked to heredity. Lack of oxygen during the birth process can result in this brain damage. Some things that can raise the likelihood of a baby having CP are premature birth, multiple births, low birth weight, or jaundice. What organ systems does cerebral palsy affect? Cerebral palsy affects the nervous system because it is a group of disorders that involves the brain. This affects the system's functions such as movement, learning, hearing, seeing, and thinking. It also affects the muscular system. Cerebral palsy distorts messages from the brain, which causes increased muscle tension or reduced muscle tension. Over time, movement can get even more limited as the patient grows. Muscles get shorter, thinner, weaker, and even less flexible. Cerebral palsy also affects the skeletal system. Contractures prevent joints from moving freely, making it difficult and often painful to walk, or to reach forward to grasp and hold objects. What organs does cerebral palsy affect? Cerebral palsy affects the brain, more specifically the motor area of the brain's outer layer called the cerebral cortex. This is the part of the brain that directs muscle movement. This disorder also affects muscles and joints. Who discovered CP? Dr. John Little is recognized as the first person to study CP and define it in 1853. Dr. John Little actually had CP and drew from his experience, so people already knew that cerebral palsy existed. He was just the first person to dedicate himself to researching it. Fun fact, back then it was called Little's disease after Dr. John Little. There are 4 varieties of CP that have different symptoms. Spastic CP is where there is increased muscle tone. This means their muscles are stiff and as a result, movement can be awkward. Dyskinetic CP is where there are problems controlling the movement of the hands, arms, feet, and legs. Movement can be slow, rapid, or jerky. Sometimes the face and tongue are affected. People with ataxic CP have problems with balance and coordination. They might be unsteady when they walk and have a hard time with quick movements or movements that need a lot of control, like writing. They might have a hard time controlling their hands or arms when they reach for something. People with mixed cerebral palsy display symptoms from more than one type. The most common combination is spastic dyskinetic CP. 85 to 95% of CP is related to brain damage that occurred before or during birth. That type is called congenital. Brain damage that occurs more than 28 days after birth is called acquired. This type is usually associated with an infection such as meningitis or a head injury. CP only appears before the age of 5 when a child's brain is still in the earlier stages of development. There is no complete cure. However, some possible treatments include medication or injections that can reduce muscle tightness, physical therapy and speech therapy, surgery on bone deformities or contractures, cutting nerve fibers to reduce pain and relax the muscles. This procedure is a last resort, though. There is no way to prevent this disease, but there are ways to lessen risks, like making sure the mother is healthy and vaccinated. 764,000 people in the United States have cerebral palsy. Globally, approximately 7 million people are affected by cerebral palsy. 35,500 people have cerebral palsy in Australia. How much does it cost to care for a patient with cerebral palsy? According to Cerebral Palsy Guide, the average lifetime cost to care for a person with CP is approximately $1.3 million, in addition to normal living costs. In addition, nearly half of children diagnosed with cerebral palsy also have some form of coexisting intellectual disability, such as autism or ADHD. Thankfully, there are government programs and nonprofit organizations that can help families with this expense. Thank you so much for your time and attention. And this is my bibliography with all my sources.